Gentleman from Georgia, Mr. Woodall, is recognized for 60 minutes as the designee of the Majority Leader.
Mr. Speaker, I very much appreciate that, and I appreciate the Majority Leader giving me the time to come down here today, because I've got IPAB on my mind, Mr. Speaker. I mean, IPAB. I say that like everybody knows what that is, because we talk about it here in this chamber all day long. IPAB, a word that was not even in the lexicon of America until the President passed his health care bill. IPAB. What is IPAB? I happen to bring down with me today, Mr. Speaker, the front page of the President's health care bill, the Patient Protection and Affordable Care Act, as he describes it. You know, this was the 900-page law that was passed that completely restructured a sixth of the American economy, completely restructured it. And the question then is, when we're talking about the Patient Protection and Affordable Care Act, when we're talking about how we change the individual health care decisions that every American gets to make, what do we get for it? What's the value added there? Because I think, Mr. Speaker, at the end of the day, when folks are talking about what motivates them, it really is affordable care. I mean, that's why we named the bills this way. The Patient Protection and Affordable Care Act. We want patients to be protected, to be able to make their own health care choices. We want care to be made available to folks at prices that American families can afford. 900 pages in that health care bill, Mr. Speaker. Now, IPAB is kind of the, how would we describe it? We call IPAB the hammer in the health care bill, because there are lots of ways to save money, Mr. Speaker. You can save money by introducing competition into a system. You know, how many Coke machines do you walk by? I'm from Atlanta, Mr. Speaker. I've got a soft spot in my heart for the Coca-Cola company. But how many Coca-Cola machines do you pass on the street where the Coke is selling for $3 a can while the Pepsi right beside it is selling for $1.50? How many? Have you ever seen that happen? The answer is no, because competition completely moves those machines out of the marketplace. If the Pepsi's $1, the Coke's going to be $1.02. If the Pepsi's $2, Coke's going to be. Competition controls those prices. What controls prices in the Patient Protection and Affordable Care Act? Because we've heard time and time again, Mr. Speaker, on the floor of this House, that the Patient Protection Act restricts my choices as a consumer. We've heard time and time again on the floor of this House, Mr. Speaker, that the Patient Protection Act restricts doctors and the services that they provide. We've heard time and time again, Mr. Speaker, that the Patient Protection Act restricts the choices that insurance companies can provide. So if it's all of these restrictions on competition, how in the world does the Patient Protection Act save the money that needs to be saved to make health care affordable? The answer is this. It's in Section 3403. And again, I don't encourage folks at home to read this bill, Mr. Speaker, unless they've got time on their hands. There are lots of good summaries out there. Again, it's over 900 pages long as signed into law, and I don't think folks are going to be able to read this back in their offices, Mr. Speaker. This is about 46 pages that I've put up here just on one in case we needed to reference it, but 46 pages of law defining this brand new thing that we've never had before in America, the Independent Medicare Advisory Board. And if you read these 40 pages, Mr. Speaker, what you're going to find is that the Congress that passed the President's health care bill, and it was not this Congress, Mr. Speaker. You were not here in that Congress. I was not here in this Congress. It did not pass the Congress under normal rules and procedures. It passed in a manipulated reconciliation process designed intentionally to thwart the will of the House and of the Senate. But in that bill, they said Congress can't control these costs. And candidly, I'm glad. I don't want Congress controlling my health care costs. So what did they do? They went to an independent commission. The President is going to appoint this commission, Mr. Speaker. The President will appoint members to sit on this Independent Medicare Advisory Board. And what they will do is decide where Medicare should save money. Now, my mom and dad just went on Medicare, Mr. Speaker. I sit down with them. I look at their statement of charges that they get back when they go to the doctor's office. It's not always easy to understand, but we go through it together. And it occurs to me that if Medicare is going to save money, there's only one way Medicare can do that: if we don't allow competition in the system, if we don't allow patient choice in the system, if we don't allow provider choice in the system. There is only one way that Medicare can save a dime, and that is by restricting services. Restricting services. Now, that comes in lots of different ways, and I want to make sure I'm absolutely candid, Mr. Speaker, and accurate. Candid and accurate, because this is the panel. Do you remember the death panel discussions? Do you remember that becoming a part of the lexicon in America? The death panels that Congress was going to create? This is that. I mean, this is where that idea came from, because what we have here is a board that makes decisions, recommendations about how to change Medicare spending. Well, if we're not going to provide competition, if we're not going to allow doctors more decisions, if we're not going to allow other providers more decisions, then the only way to change the financing structure of Medicare is to restrict either the services that Medicare provides or the amount of money that is being paid to providers. Now, I want to give my friends who passed this bill the benefit of the doubt, Mr. Speaker. I don't believe there's a single member of this body who would stand here in the well and say that their decision about how to save the Medicare program is to restrict the services that Medicare beneficiaries can access. Not one. I don't think one member, Republican or Democrat, will come to the well of this House and say that their proposal for saving Medicare is to find seniors in need of health care and tell them no. Not one. But, Mr. Speaker, what's the effect, then, of the Independent Payment Advisory Commission? Let's look at what folks have said. This is George Miller, one of my colleagues here on the floor of the House, a Democrat from California. We're taking up tomorrow a bill that will repeal this this patient advisory board, this Medicare board. We're going to repeal it tomorrow, I believe, here on the floor of the House. And when talking about that, my colleague from California said this: IPAB is a critical measure for lowering health care costs. And he's absolutely right. I'm not picking on him at all. I'm endorsing what he has to say. That's what these 40 pages of law, Mr. Speaker, do. They are all designed to cut costs. But we've talked about it. If we're not going to introduce competition, if we're not going to introduce choices, if we're not going to introduce options, how are we going to cut costs? We all agree, Republicans and Democrats alike, that the IPAB board is a critical measure for lowering health care costs. Well, Peter Orszag, the OMB director, first one that President Obama used, said this about health care costs in Medicare: the core problem is that health care costs are concentrated among expensive treatments for chronic diseases and for end-of-life care. Now, Mr. Speaker, let me reflect on that a minute. I've just shown you the 40 pages of law in the President's health care bill that are the cost-saving mechanism that the President has proposed and that has been passed into law. And the OMB director, Office of Management and Budget Director for the Obama administration, said this: the core problem is that health care costs are concentrated among expensive treatments for chronic diseases and end-of-life care. Now, Mr. Speaker, what choices then does that give us? If we agree that IPAB is a critical measure for lowering health care costs, and if we agree that health care costs are primarily concentrated with expensive treatments for chronic diseases and end-of-life care, how exactly is this unelected board going to lower those costs? It's an honest question, Mr. Speaker. If that's what has to happen for Medicare to be saved, exactly how is this board going to do that? And every American on Medicare, every American approaching Medicare, needs to have that on their mind. What is it that IPAB, this unelected board, is going to do to save costs? We all, Republicans and Democrats alike, agree that the only purpose of IPAB is to control costs. We agree, Republicans and Democrats alike, that the money in Medicare is concentrated among expensive treatments for chronic diseases and end-of-life care. So if the IPAB is going to control costs, and the costs are here, what choice do we have but to deny individuals expensive treatments for chronic diseases and end-of-life care? What else is there? Now, to me, that's common sense, that this is where the President's proposal is going. I do not endorse this proposal. I was not here in this Congress, Mr. Speaker, when this proposal passed, and had I been here, I would have voted an enthusiastic no. But nevertheless, it is the law of the land as we sit here today, and our seniors are at risk. How many times have we heard supporters of the President's health care bill say, no, 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 no. IPAB is not a Medicare rationing board. In fact, if you want to dig deep into these 40 pages, you'll find that said over and over and over again. Folks continually say this is not a Medicare rationing board. But we know where the costs are, and the question is, how do we control them? What my friends who support the President's health care bill say is, no, no, no. We're not going to deny care to Medicare beneficiaries. We're just going to clamp down on payments to doctors. That's what they say. We're just going to change the payment schedules for doctors. Well, I've got news for you, Mr. Speaker. That's been the Medicare plan for decade upon decade upon decade upon decade, and this is what you get. This is from a CNN Money article from January 6th of this year titled, "Doctors Going Broke." And it recounts the many changes that have happened in the Medicare system as we continue to do nothing about choices, nothing about options, nothing about getting the consumer involved in healthcare decisions, but continuing to use the same old broken tools to solve the Medicare issue. It says this, Money Magazine, CNN. In 2005, Medicare revised the reimbursement guidelines for cancer drugs, which effectively made reimbursements for many expensive cancer drugs fall to less than the actual cost of the drugs. Now, you can tell me you don't want a Medicare rationing board, Mr. Speaker. I don't want a Medicare rationing board either. But if what we're going to have is going to cut the costs of Medicare, and they are going to do that by cutting reimbursements to providers, and what we already see is that we're cutting reimbursements to providers to a point that those reimbursements fall below the cost of the service, what do you think is going to happen to Medicare beneficiaries when they go to seek service? I'll tell you. You know, the President's health care bill, Mr. Speaker, primarily solves the challenge of the uninsured by dumping them onto state Medicaid policies. Well, I don't think that's a particularly creative solution, but it is certainly an option. My uncle is a primary care doc down in central Georgia. Used to be a bunch of docs who'd see Medicare patients in that part of the world. Today, he's the only one who'll see Medicaid. Only one. In 5 counties, Mr. Speaker, he's the only doc who will see Medicaid patients. Now, don't tell me that our goal here in Congress is to help patients find care if we are going to lower reimbursement rates to a place where no doctor will accept them. I don't care that you have an insurance policy if you can't find a doctor who will take it. It does not matter that the government says you're guaranteed health care if you can't find a doctor who will provide it. Mr. Speaker, that's not news to anyone who's had a job in the private sector. That's not news to anyone who's had to write paychecks from their business, and it's not news to anyone who's been a consumer. You ever had that coupon? I'm a coupon clipper, Mr. Speaker. I cut them out of the Sunday paper, go into the store, got a big old coupon, think I'm going to get a good deal. The store doesn't carry the product. What's that coupon worth to me if I can't find the product, Mr. Speaker? Not a thing. That's what we're doing when we clamp down on cost. Don't you dare believe that we can continue to cut docs year after year after year after year, and that your family and my family who are on Medicare are going to be able to find care that they cannot. That same article, Mr. Speaker. Doctors going broke. Again, January 6, 2012 from CNN Money Magazine. Dr. Williams Pence said recent steep 35 to 40% cuts in Medicare reimbursements for key cardiovascular services such as stress tests and echocardiograms have taken a substantial toll on revenue. These cuts, he says, have destabilized private cardiology practices. A third of our patients are on Medicare. So these Medicare cuts are by far the biggest factor. And then, Mr. Speaker, he says private insurers follow Medicare rates. So those reimbursements are going down as well. You know, he's right about that. When the federal government pays 2/3 of all the health care costs in this country, Mr. Speaker, and the federal government decides it can get away with paying less, guess what? Everybody else wants to get away with paying less too. That's a good capitalist system. I don't fault folks for that. What I fault folks for is standing on the floor of this House and promising the American people a program that they pay into all of their life so it will be available for them in their time of need, and then cutting rates to a place where you cannot find a doctor who will serve you. Mr. Speaker, the hypocrisy of saying that we're going to care about people in their time of need and putting the people out of business who provide for them in that time of need is deafening. Mr. Speaker, I'll go again to that same article. Again, January 6, 2012. Doctors going broke. Same doctor, William Pence, cardiologist there in Philadelphia. If this continues, I might seriously consider leaving medicine. I can't keep working this way. He goes on to talk about how the law of the land is going to provide even further cuts. He says if that continues, it will put us under. It will put us under. My dad's going in for heart surgery in about 30 days, Mr. Speaker. 30 days. We shopped long and hard to find a doctor that we would trust to do that surgery, just as every American family does. Who are folks going to trust, Mr. Speaker? Who are folks going to find if we put the people who provide the care out of business? IPAB, Mr. Speaker. These 40 pages from the President's health care bill, the only 40 pages that are designed to reduce costs, do not reduce cost through competition, do not reduce cost by providing consumer choices, do not reduce cost by getting consumers involved in their own health care. They reduce costs or by cutting reimbursements to a place where the marketplace rations those services on its own. Don't believe for a moment, Mr. Speaker, that cutting reimbursements to doctors doesn't equal cutting services. And that's really the hypocrisy, Mr. Speaker, for lack of a better word, that I hear on the floor of this House. Oh, we're going to go out there, we're going to save all this money. How are you going to do it? We're going to go out there, we're going to cut those reimbursements to docs. All right. Sounds like you're liable to end up rationing services. Oh, no, IPAB, that's not going to ration any services. No. They don't have the authority to cut out services. That's not what they do. Well, what are they going to do? Well, they're going to cut the reimbursement rates. Well, what's going to happen? Well, docs will just keep providing those services. We saw it here. Money Magazine tells you when you're only reimbursing folks at the cost of the service or less, they're going to quit providing. 31%. This is according to, you've seen it, that factcheck.org, those folks who go around and look at all the claims politicians make and try to figure out which ones are real and which ones are full of hot air. This is what they said. 31% of primary physicians restricted Medicare patients in their practices. You know what that means? 31% of all the doctors in the land who provide primary care services, those most needed services, said they do not take every Medicare patient that comes knocking on their door. They can't. They restrict how many Medicare patients they'll take into their practice. We've already seen we're putting docs out of business. We're forcing docs into retirement. Who is going to provide the care, Mr. Speaker? Who is going to provide the care if we force the people who do it today out of business tomorrow? Back to factcheck.org. 62% of family practitioners would stop accepting Medicare patients if reimbursement rate cuts follow current law. Hear that, Mr. Speaker. Hear that. Let me say it again. If reimbursement rates follow the current law. I'm not talking about if some new draconian procedure gets put in place. I'm not talking about if some crazy future Congress comes in here and tries to further socialize health care. No, no. If the current law of the land, as passed before you and I came to Congress, Mr. Speaker, if the current law of the land continues, 62% of family practitioners would stop accepting Medicare patients. What's IPAB going to do? It's going to control costs. How's it going to do it? It's going to do it by cutting reimbursements to providers. What happens when you cut reimbursements to providers? 62% of all of America's family practitioners will stop accepting Medicare patients. Mr. Speaker, what we do here has consequences. This isn't some think tank downtown that has the freedom to just pontificate, make recommendations, wonder how things could have been. This is a body where every single thing that we do has the potential to affect, positively or negatively, the lives of every single citizen of the land. There are no free lunches in America, Mr. Speaker. There is no something for nothing. You can control costs through competition. You can control costs through getting consumers involved in their own health care. You can control costs by providing folks with more choices. You cannot control costs responsibly by putting providers out of business and rationing care through the long lines that are then going to result. We're going to deal with this bill tomorrow, in fact, and I'd be happy to yield to my friend from the Rules Committee to help make that happen.
For what purpose does the gentleman from Florida rise?
Mr. Speaker, I sent to the desk a privilege report from the Committee on Rules filing under the rule as we're just speaking about.
The clerk will report the title.
Report to accompany 1, resolution providing for consideration of the bill, H.R. 5, to improve patient access to health care services and provide improved medical care by reducing the excessive burden the liability system places on the health care delivery system.
Referred to the House calendar and ordered printed. The gentleman from Georgia may proceed.
Mr. Speaker, I appreciate that. I'm very lucky that I was here when my friend from Florida came to file that rule, because that's another example that what we're doing down here isn't just howling at the moon. It isn't just blowing the hot air. What I'm talking about here on the floor right now is repealing this Independent Payment Advisory Commission to stop this cycle of destruction that has already been put into place. And no sooner do we come down here to do it than my colleague from the Rules Committee comes down to file this rule, Mr. Speaker, so that we can do this bill not 2 years from today, not after the next election, not 6 months from now kicking the can down the road, but so that we can bring this bill to the floor tomorrow to address the concerns that we're talking about today. That's why you and I came to Congress, Mr. Speaker. That's why this whole freshman class came to Congress. You know, I've only been here about, 14 months now, Mr. Speaker, 15 months? And what I found is that each and every day, my colleagues in this freshman class do not evaluate their success by how many favorable newspaper articles are written about them. They don't evaluate their success by how many times they've seen their face on TV, and they certainly don't evaluate their success based on what the mass media writes about them in this town. They evaluate their success based on whether or not the promises they made to folks before they got elected are the priorities that they've set for themselves now that they have been elected. And each and every day, I see people making that a reality. Republicans and Democrats alike, Mr. Speaker, in this freshman class, came to this Congress for a different purpose, with a different mission, with a different vision, and I see them implementing it every day. It makes me proud. Speaking of being proud, Mr. Speaker, you know, I tell folks back home, they say, Rob, how come we don't see you on Fox News preaching the good conservative news? I tell them, Mr. Speaker, that anybody who's watching Fox News already knows the good conservative news. They don't need to hear it from me. The folks who need to hear from me are the folks who are watching MSNBC. That's who needs to hear my message, and I happen to bring some MSNBC knowledge down here with me today. This is a headline recently from the webpage, Mr. Speaker. This is what it said. In risky election year move, Republicans offer Medicare alternatives. Ooh, kind of sounds ominous, doesn't it, Mr. Speaker? Ominous. In risky election year move, Republicans offer Medicare alternatives. Why? Why? For the reason I just talked about, Mr. Speaker, where we have this freshman class, where we have these senior members of Congress who didn't come here to pontificate, who didn't come here to grandstand, who came here to make a difference. I don't care that it's an election year. In fact, if anything, in an election year, Mr. Speaker, we ought to do more of the right things. We ought to spend even more time each and every day getting it right. Risky election year move is what folks say. I tell you, Mr. Speaker, I'd be disappointed if we did anything else. Medicare is in crisis. This IPAB board, Mr. Speaker, is further destabilizing the Medicare program. You're dadgum right. It may be a risky move, but we did it anyway because it's the right thing to do. I sit on the Budget Committee. That's actually who they're talking about. This is a March 15th article, Mr. Speaker. And they're talking about the plan that we in the Budget Committee are going to hold a markup on tomorrow that does what? All of these things I've been talking about, Mr. Speaker. Bringing choices to consumers. Bringing competition to the Medicare system. Investing consumers in Medicare outcomes. It does all of those things, Mr. Speaker, that we believe can control costs using the power of the marketplace, using the power of the American people, using the power of the American family, and not just by rationing care as this IPAB board does. This was the headline. I'm going to read it again, Mr. Speaker, just because I like it so much. In risky election year move, Republicans offer Medicare alternatives. They go on to say this. Running a political risk during an election year, Republicans continue to offer proposals to cut future Medicare outlays. Medicare outlays. That's this dramatic rise we see in Medicare spending, Mr. Speaker. It's not a rise that's associated with quality of care. It's not a rise that's associated with whether or not people get the services they need. It's a rise that's associated with an out-of-control federal health care program that has absolutely no control, absolutely no competition at all, absolutely no free market involvement at all. And it's going broke. We have a proposal to fix it. What is our proposal? Well, I didn't just bring our proposal, Mr. Speaker. I brought our proposal, and I want to compare it to the President's approach. There are two things we need to talk about when we talk about changes to Medicare, Mr. Speaker, and you know this better than most. There are changes to the Medicare program that save it for future generations, and then there are changes to the Medicare program that destabilize today's seniors. Big difference in those two things. I'm in my 40s, Mr. Speaker. My Uncle Sam has to come to me today and say, Rob, I know you've been paying your Medicare taxes in every single paycheck since you were 16. And I know we promised you that Medicare was going to be there for you like it was there for your grandparents and your parents. But, Rob, we got bad news. Turns out we overpromised and we're under-delivering, and we've got to renegotiate our Medicare contract with you. We do. That is the bad, bad news for your generation, Mr. Speaker, for my generation, and for everybody younger. The government, surprise, surprise, has overpromised and under-delivered. And the time to tell me that is now, not when I'm 65 and I can't make any more choices about my life, but today, while I can still make accommodations. So I've divided this chart, Mr. Speaker, up into two categories. What are our proposals for current seniors? And what are our proposals for future seniors? And I've done the same thing for the President's plan, because it is important that we do keep our promises here. It's no senior's fault in this country that they're dependent on Medicare. They paid into it their entire life for the Part A through their Medicare taxes. They were promised it would be there for them in their time of need. They didn't ask for it. They didn't solicit it. The money was taken from them, and now they deserve those benefits. So here's what we do. The program that's coming out of the House Budget Committee, the program similar to what was passed on the floor of the House last year and is coming to the floor of the House next week, Mr. Speaker, has absolutely no changes. No changes, Mr. Speaker, no changes for today's seniors. If you're on Medicare today, no changes. No disruptions in our plan, Mr. Speaker. That service, it's already begun for you and is going to continue uninterrupted for as long as you need to utilize the program. But the program's going bankrupt, Mr. Speaker, and so we're making some changes that will preserve and protect it for this current generation of seniors. If we do nothing, bankruptcy looms on the horizon. And if current seniors want it, we'll allow them to get what I'll call personalized Medicare, like what members of Congress have. You know, Mr. Speaker, folks often think, in fact, my mom sends me that email about once a week that says, Rob, I can't believe you're getting all this free health care in Congress. You know that's nonsense, Mr. Speaker. We have exactly the same health care plan in Congress that every federal employee across the country has. And that plan is this. You open up a book, has about 30 plans to choose from, and you choose the one that works best for you. Imagine that. Imagine that our seniors today have had a lifetime of health care choices, and the day they turn 65, Mr. Speaker, they surrender their freedom as an American, and they are forced into a health care system that they cannot opt out of. Cannot opt out of. Oh, you're in it. You can opt out of Medicare Part D. You can opt out of Medicare Part B, but you cannot opt out of Medicare Part A. You are in it. And if you want a doctor that won't take you, he'll take other Medicare patients, but he won't take you. The federal law of the land prohibits you, Mr. Speaker, from paying cash out of your pocket to see your doctor. That's the law of the land where? Russia? China? It's the law of the land in America. You turn 65, you enter the big government health care program. Suddenly your freedoms begin to be eroded. We say no. We say let's make Medicare have the choices that we as members of Congress have, and let's make those available to current seniors. So to recap, Mr. Speaker, no changes or disruptions in our plan. We preserve and protect the program for current seniors for the 30-year life of the program, and we personalize Medicare to make it more like what we have in Congress so that we can give those folks choices. What does the President do for current? He empowers 15 unelected bureaucrats to cut Medicare in ways that will most certainly deny seniors care. Do I need to go back to the 40 pages, Mr. Speaker? The Patient Protection Affordable Care Act, Section 3403, the Advisory Board, IPAB, this is what it does. It's the 15 unelected bureaucrats that have the power to cut Medicare in ways that, as we have discussed, will most certainly deny care. If what your plan is to cut reimbursements to doctors, fair enough. I think it's short-sighted. I think it's destructive. But if that is your plan, embrace that plan. I say to folks who support the President's health care bill, embrace it and defend it, but be honest with the American people who most certainly know that if you cut those reimbursement rates to a level that doctors cannot see patients, they will not see patients. And here's one that doesn't get talked about much, Mr. Speaker. The President's plan raids the Medicare program and removes $682 billion. This is a program that's already going bankrupt. This is a program that already needs substantial reform to protect it and preserve it for another generation. The President's health care bill, which isn't something that might happen, it's something that's already the law of the land, takes $682 billion that was intended for Medicare beneficiaries and cuts it out. Saves it is the term of art they use around here, Mr. Speaker, as you well know. Cuts it and saves it. What do they save it for? So they can bring it over here and spend it on the President's new health care plan for the rest of America, the non-seniors. Program's already in trouble. Current law under the President's health care plan removes $682 billion designated for Medicare beneficiaries, takes it out, moves it to the rest of the population. Again, exacerbating the challenge. Future seniors, what are we going to do? Well, our plan, Mr. Speaker, coming out of the Budget Committee, coming here to the floor of the House, as passed by the House last year, is personalized Medicare. Not just for current seniors, but for future seniors, Mr. Speaker. For folks like you and me in our generation, when we get to Medicare age, we would have choices. All of Americans would have choices to choose the plan that works best for them. Do you need a plan that covers prescription drugs? Choose that. Do you need a plan that is flexible so you can summer in Florida and winter in New Jersey? Though I suspect, Mr. Speaker, they'd probably be summering in New Jersey and wintering in Florida. But if they travel like that, maybe they need that plan. Maybe they still have young kids in the house, and so they need a plan that speaks to youngsters as well. Folks could choose the plan, Mr. Speaker, personalized health care, just like what we have here in Congress. Our plan, Mr. Speaker, means that wealthy families will get less, and sick and low-income families will get more. Mr. Speaker, we talk about shared sacrifice around here all the time, and I am not in favor of raising taxes on the American people. American people can't afford it. The economy can't survive it. But what we can do is start giving away less from Washington, D.C. And so what we say for future seniors is, folks in my generation, your generation, Mr. Speaker, is that your support from the Medicare program is going to be less than low-income families. If you've done well in your life and you can afford to help with the costs of your Medicare, we're going to ask you to do that. We're going to means test these things. We're still going to be there for you. Medicare program's still going to be there for you. Promises we made to you still going to be kept. But in the renegotiation, we're going to confess what America already knows, which is that this program is going bankrupt and cannot be sustained, and that in order to sustain it, we're going to ask folks who can't afford it to pay more and recognize that folks who can't afford it will pay less. That's our program for the future, to save and strengthen Medicare. What does the President propose? And this is so important, Mr. Speaker. Can I go back to what my good friends at MSNBC said? This is how they describe this plan that I'm just describing to you. In a risky election year move, Republicans offer Medicare alternatives. The President, for future seniors, offers no serious plan to save Medicare. If I had the President's budget down here with me, Mr. inches tall, and it's a serious budget. I don't fault him for submitting the budget. I'm glad he did. It lays out his priorities and his strategy for saving America. But there's not one Medicare reform proposal in those 12 inches of budget. Not one. Not one. Why? Because traditional politicians, Mr. Speaker, think it's risky in an election year to propose things that shake up the status quo. Mr. Speaker, it ought to be risky in an election year to maintain the status quo when you know a program depended on by millions upon millions upon millions of seniors is going bankrupt today. Not tomorrow, not 10 years from now. It's happening today. It's underway today. The time to stop it and save it is today, and I don't care if folks think it's scary to propose it. That's what we came here to do. What happened, Mr. Speaker? What happened to folks that caused them to believe the reason they came to Congress is to get reelected? What happened? You didn't come here to get reelected. I didn't come here to get reelected. We came here to make a difference for families back home. We came here to draw a line in the sand for saving America. We came here to get the American dream of a successful economy and freedom back on track. It ought to be risky to sit here and do nothing, Mr. Speaker. That ought to be the risky thing. What has happened to this country that the risky thing for those who call themselves public servants is to do something instead of nothing? Because that's what the President proposes in his 10-year budget plan. Nothing. Nothing that does one thing, that takes one baby step forward towards saving Medicare. In the Budget Committee, we're proposing serious alternatives. Are they going to be frightening to folks in my generation? I don't think so, Mr. Speaker. You and I have a long time till retirement, despite all of our gray hair. We've got a couple of decades left before we get there, and we've got time to prepare. And we will, and America will. But it is our responsibility to offer those alternatives. The President offers nothing, and Medicare goes bankrupt. This chart says it all, Mr. Speaker. There is a path to prosperity for America that we are proposing here in this House. And there is the President's approach, and they could not be more different. Our approach tells the American people the truth. There are a lot of political pundits out there that believe telling people the truth is a risky thing to do in an election year. Mr. Speaker, I tell you it's our solemn obligation. I tell you the oath that we took requires us to tell folks the truth. I tell you the responsibility that our voters back home have entrusted us with requires us to be bold. And if the consequence for trying to save the Medicare program, not just for this generation of seniors, but for a generation to come, if the consequence of that is that I frighten voters back home and I get defeated, so be it. So be it. No one sent us here to get reelected year after year. They sent us here to do the work that they asked us to do. They sent us here to follow through on the promises that we made during the last campaign. They sent us here to offer serious solutions to what we all know, Democrats and Republicans alike, are serious problems threatening the future of our republic. And none is more serious when it comes to the social safety net here in this country than the giant fiscal crisis looming in Medicare. I'll leave you with this, Mr. Speaker. We have the law of the land that's already on the books. It's in the President's Patient Protection and Affordable Care Act, that bill that raids Medicare in order to fund his other social priorities, that bill that hastens its demise, the demise of Medicare, rather than preventing it. And in that, they find 15 unelected bureaucrats that they say will not ration services. They'll just cut reimbursements for docs. And we have testimony after testimony after testimony after testimony that says, go ahead. If you think you need to cut docs, but just know those docs are not going to be there for you when you need them to be, because they can't. Because they can't. Do you really believe it, Mr. Speaker? Does anybody in America really believe it? Find your primary care doc who lives down the street from you. They're in your Sunday school class. They coach your kid's soccer team. You know who they are. Do you really believe that they're the ones that are driving the Medicare program into bankruptcy? Do you really believe it? Or does the Washington establishment just use our docs, the healers in our community, those folks who are there for us when we need them the most? Does the Washington establishment just use those folks as the scapegoats for what is a much more serious, much more systemic underlying problem with the way that we finance federally funded healthcare systems in this country? Competition has served this country well, Mr. Speaker. Individual responsibility has served this country well. Entrepreneurship and innovation have served this country well. And we have a choice now to embrace those functions that are so indicative of who we are as Americans and where we've come from, and use those tools to set Medicare on a new and sustainable course. Or we can go back to business as usual. More pages of federal regulation, more blaming other people for the problems we've created, more unelected boards of bureaucrats who make healthcare decisions for us instead of letting us make those decisions within our family. Choice for me is clear. Mr. Speaker, you know these aren't things that we're just down here to talk about. You know these aren't just ideas that are being brainstormed. We have a real opportunity to make this change, not 2 years from now, not after the next election, not 6 months from now, but tomorrow. Tomorrow, we'll bring a rule to the floor of this House to allow for consideration of a measure that will repeal IPAB once and for all. IPAB, this word that was not in our lexicon 2 years ago, but now threatens to control the health care decisions of every senior in America. With a successful vote tomorrow, Mr. Speaker, we can make that a thing of the past. And with that, I yield back the balance of my time.